Hi, everybody. I'm Dr. Kristen Donnelly, one of the good doctors of Abbey Research, and we are obsessed with the idea that curiosity can change the world. And one of the best ways to do that is to listen to people and get to know other people's lives and stories. And that's what this series is. It's called Welcome to My World, where I have the privilege of talking to wise and wonderful folks from all walks of life. And we get to hear a little bit about what their world is like. And today is no exception. I am joined today by Deborah Vick, who I met on Clubhouse, that you may or may not be on, and you should be, because it's a great social networking app. And I get to meet people like Deborah who have a very different life than mine. And she is graciously willing to come and chat about it with us. So Deborah, thank you so much for joining me.
Thank you for having me. I greatly appreciate it, especially with the communication between patients and advocates. So to step back for a second, for those who don't know me, I'm Deborah. I am actually a rare disease advocate, as well as a patient advocate, motivational speaker, pain management, and mindfulness coach. I also started recently with several other advocates, a nonprofit for empowering people with disabilities, but not just people with disabilities, also empowering our local communities from the classroom all the way to the boardroom. And that includes working with doctors. Mainly because we're trying to get more of a voice for those of us with chronic conditions who become our, I like to say, professional patients. So we get to know our bodies really, really well. And unfortunately, with the communication with doctors, we don't always get to have that time and space to communicate what we know is happening, which could delay a lot of our treatments or diagnosis, especially for those with rare diseases, which I'll mention in a little bit, but it could be a very long journey for a diagnosis. So I love opportunities to speak not only with others that are battling conditions, but with doctors.
I think it's incredibly important for folks who haven't done the chronic pain journey to chronic condition, chronic anything journey, to understand that, like, the minute you hear the word chronic, you should assume long and arduous on some level. And I know that I have a long and arduous pain management journey. You have a long and arduous kind of a lot of different things journey from what it understands. So would you mind telling everybody a little bit about that process for you?
So I have multiple rare diseases, and all of which cause significant pain, as well as cognitive and motor skill challenges and neurological challenges, all of which took a long time for diagnosis. So I do have Ehlers Danlos with a whole host of the secondary disorders that are common. Pretty much have like the laundry list checked off of almost everything. It's just the way it goes. And also dysautonomic dysfunction. So I do have a problem with losing consciousness and passing out on a regular basis, despite a wide array of medical treatments. And I have another autoimmune disease called Myasthenia Gravis, which is actually the sign behind me.
Yeah, I was going to ask you, because that's one I've not been exposed to before. So
there's my sign, and I made this on
It looks great. Can you tell me a little bit what that is? Because honestly, this is my first exposure.
Okay, so it is an autoimmune disorder in which the body antibodies attack the receptors from the brains to the muscles. So it can affect your ability to speak, walk, talk, breathe, swallow, eat, all the bodily functions. It's in the same family as MS and ALS, and under the umbrella of muscular dystrophy. Okay. And so it is a very rare disease, and even rarer to have EDS and myasthenia. So my Ehlers Danlos took me 15 years to get diagnosed, despite being on crutches from age 13 on. But myasthenia also took me another 4 years past everything else for diagnosis, because I had a doctor who wasn't looking for anything rare, which I kind of looked at him going, I already have multiple rare diseases, which automatically makes me predisposed to other rare diseases. And my face was already shutting down. And again, it came back to the lack of communication and listening to the female patient when I was explaining that I had severe muscular weakness. I woke up after one of my neck fusions feeling like I had over 1,000 pounds on top of me. And I knew it was severe weakness. And this is me, I pushed myself on a 5K walk in my manual chair. So I was physically active. I was mono skiing. I was doing adaptive taekwondo in my wheelchair. So I had a lot of strength, went to no strength at all. Like not even picking up a piece of laundry. And I knew it wasn't my dysautonomic dysfunction. Yeah. I knew it wasn't medication related, because I've been on meds since, I was 13. So I know what medications are. Lost count of how many surgeries I've had. So I know what my reaction is after surgery. I know what neuropathy is. So I knew it wasn't any of those things. I wasn't listened to until 4 years later when I woke up and it looked like I had a stroke. A whole left, mind you, it was 3 months before my wedding renewal ceremony. So it's kind of freaking out because we didn't have a real wedding ceremony when we first got married because of medical conditions. Supposed to be at 5 years, but then I had back surgery. Then I had 2 neck surgeries. So finally, we're like ready to have this wedding renewal ceremony, have this dress. We've adapted it for my back braces. We've adapted my wheelchair for the wedding dance. And 3 months before the wedding ceremony, I woke up and looked like I had a stroke. So, of course, my first thought was, oh my God, the pictures.
Yeah. That would have been mine too. Like, oh, for crying out loud.
Of my dream. We were getting trained for a wedding dance, and our dance is actually on YouTube. We had a most phenomenally beautiful wedding dance. At the time, there weren't any females in wheelchairs doing wedding dances on YouTube. And I was really frustrated and flustered, and I reached out to one of the people that I had met at Abilities Expo. And we were actually by American Dance Wheels on the East Coast training us, and I had an instructor on the West Coast who was Skyping at the time. And that's how we learned our wedding dance. And it was an absolutely gorgeous, beautiful wedding dance. It was the dream dance of my dream with a dip at the end. I mean, it couldn't have been more perfect, so it was a beautiful dance. But needless to say, I was freaking out about pictures, right? And even like we're talking previously, my eyes used to be big and round, and now they droop a lot, and I try to put mascara on and bring it up. We were like trying to teeth them up. I mean, we're doing all these crazy things. Well, my family is all Asian, and they're kind of like, it's okay. We all look together now. We all look like part of the same family. But it was a big issue for me. And eventually, I was diagnosed, and the doctor goes, oh, wow, you look worse in person than the picture. Picture of my eye literally was shut, and my mouth was like hanging down. I mean, I couldn't imagine how the picture could have looked any worse. So obviously at that point, I fired the doctor.
Yeah, I'm about to say, how incredibly insensitive.
Yeah.
Oh.
So, and my picture was pretty darn bad. I mean, I look at the picture and you literally can see my eye is shut on one side. The other eye is like half shut, and my mouth is completely drooped to the side and down. So I was going, I'm really not sure how this picture could have looked any worse than the way it looks. And eventually it's like, well, you might have this. And he was very nonchalant about it. So I'm going, okay, you know what? And he automatically put me on autoimmune suppressants, which freaked me out because I work with kids, right? So immediately I'm going, I already get infections. I already have chronic bronchitis. I'm already on oxygen. And you're telling me I got to go on autoimmune suppressants. So of course, I mean, obviously I had to, but it was a big, huge freaking out moment for me because now with myasthenia, if I get sick, it's pretty severe. Minor allergies, I'm on my BiPAP because I can't breathe. I mean, it's like it helps me breathe both directions versus the CPAP, which is just for pulling out air, for when you to get air in. The BiPAP actually puts in and out. It's almost like a ventilator. In fact, during COVID, they were asking, I'm like, obviously didn't give up mine, but they were asking for people for their BiPAPs because they can act as a way in a lower level into ventilator without being intubated. So a simple cold allergies, I'm on BiPAP trying to breathe with it. So I was kind of really not thrilled about this whole autoimmune treatments, and I have to get Rituxan, which is not a great drug to get because it can increase your risk for rare cancers, which I just love that one, which is like, yep, okay, it's just give me another risk now. I mean, so, and I'm on a series of autoimmune suppressants, as well as I get IVIG every 2 weeks at home for 2 days. So my nurse is kind of like family at this point, which we're going to miss when we move. But, I get IVIG at home. I do home fluids because I can't drink enough because of GI issues. So it's my whole life is literally between treatments and appointments. And like right now, I'm kind of stressed because we're moving and I'm trying to figure out how to get all of my appointments scheduled in advance to get all of my treatments. And even now they're telling me I might have to fly back, which I'm kind of like, I can't fly right now because I'm not getting an infusion. And I haven't gotten the vaccine yet because of my other treatments preventing me from getting the vaccine. So I'm like, yeah, I'm not going to fly. So it's just been kind of a really long journey and a journey of acceptance. So we were talking a little bit before about my background. I grew up being very physically active. I mean, I hiked the Grand Canyon when I was going into 5th grade, so I grew up hiked the Zion, Bryce Canyon, Yellowstone. I mean, I was My dad is a teacher and a coach, and my mom's a nurse. We'd go camping over the summer, and I was very physically active. I mean, I remember the garage having lacrosse sticks and hockey sticks and roller skates. I mean, you name it, we had it, right? And I wasn't anything phenomenal athlete, but I did like sports. And my first injury happened in sports, and I ended up probably about a month or so after my bat mitzvah. And I only remember because I remember I carried the Torah for my bat mitzvah, which was a really big deal. So I remember I wasn't on crutches then. That's kind of how I know in my head when it happened. And I had an injury in track and field. I was doing the triple jump, and I landed on crutches. Dislocated my knees and ended up on crutches from age 13 on. And it was at that time, I was not labeled disabled. I mean, my parents never put that label on me. I was very fortunate. They always empowered me. And at that point, when I couldn't do sports anymore, I was like a manager for teams, and I was still involved. And then eventually I did all the after school curricular programs because I was going to a career in politics, right? So I was very centered towards that. And each year in high school, I had a new knee surgery, and each year it failed. And I had a lot of, I don't want to gloss over this. It's taken me actually processing during COVID to understand the bullying experience that I went through in high school, college and graduate, and in law school. A lot of it was unintentional exclusion. And I will straight up tell you that unintentional exclusion is just as harmful as the intentional bullying. You know, it marks you, it leaves you with that lack of self-confidence, that lack of self-esteem. I mean, you could put me in front of a room, and if I'm talking politics, if I'm talking legislation, rare disease, whatever that, you know, in that realm, in the political realm, I'm okay. But you put me in that social party atmosphere, and I'm like deer in headlights kind of a thing. You know, I'm still coming to terms with, you know, acceptance of my image and my, you know, that social communication. I mean, I've done much better with Clubhouse, but again, it's not.
It is a gift in a lot of ways. Yeah.
But it's been a journey, and I always talk as a scout leader. I'm a disability awareness merit badge counselor, and one of the things we're supposed to talk about is our biggest challenge. And I always talk about, you know, the acceptance of what I can do and what I can't do, and not focusing too much on what I can't do because I'll lose the opportunities that are in front of me. And I'll go into that one, great example for that one in a second. It's always an emotional one for me too. But I always gloss over the bullying. And in fact, when I mentioned bullying, the scouts would look at me like I had 10 heads because I'm in a scout uniform. I've been a range master. They've seen me for 10 years as a leader. They can't imagine me being bullied, right? And of course, apparently, I am still a New Yorker, though I don't live in New York anymore. I still have a
It's
new
okay.
attitude.
You can't take the Northeast out of someone's soul. It's just
right.
baked
And
in.
So apparently, even in my wheelchair, I'm intimidating to people, which I still, you know, I try really hard not to be, but apparently I am. You know, I have that voice, that presence, that I'm in control, that apparently, you know, can be intimidating to people, which I still think is kind of funny, but I get it. I'm trying to be sensitive to that, but I wasn't like that all the time, right? And for so long, even in high school, and I'll just go back to this for a second because it's really important, is that I judged myself for not standing up for myself back then. And mind you, yes, I teach anti-bullying programs now, but the bucket filler, bucket dipper concept and the upstander concept wasn't verbiage 30 years ago. First, you know, and
there wasn't any. Can I pause you right here? I don't think my audience knows the bucket dipper and bucket filler.
Oh, okay. Well, that's true. We use that with kids. It's the same concept of glass being full or glass being empty with children. And there's a whole series of these books called bucket filler. And it's a concept of we give positive feedback to put into that bucket to really uplift somebody. The lid is to protect what you have in your bucket so that you can cover it and not allow bullies to come and take apart what you've built up. Bucket dipping is using negative language to hurt somebody, or any language or action that you do that can make them feel lesser than kind of concept.
Okay.
And so it is a series of books, and the YMCA uses a program as well to go into the schools and teach us at the grade appropriate level activities type of a thing.
Yeah.
And
sounds great. It would have made so much sense to me as a kid. So that, yeah.
Yeah. That's what a bucket versus a cup, you know, a cup full kind of a thing. It's the same concept. But when I look back, you know, I couldn't understand why I couldn't verbalize what happened. Part of it, you know, was no control, right? Because I wasn't diagnosed, I had no control of what was happening to me, no idea what was wrong with me. Doctors weren't believing me the level of pain I was in. I ended up having RSD, reflective sympathetic dystrophy, or now known as CRPS, in both my knees. Wasn't believed, and I had to get a very painful sympathetic nerve block test done twice. And yeah, I got to the needle before that. For you guys who don't know, you really don't want to get that test because that's a very long needle. And eventually, at St. John's, I did the test and it proved that I had it, not just in one knee, but in both knees. But again, I wasn't believed. So that wasn't diagnosed until I was in college. And I had kids that would trip me, take the kick out the crutches from underneath me. This is dating myself here. When we had wooden crutches, people would loosen the screws or take the screws out altogether. And because I was large, well endowed, I would also be grabbed at my chest, or things thrown in my chest and try to pop my boobs, apparently. I don't know where that concept came from, but I'd have a lot of that as well, including people like when I volunteered at Special Olympics, having athletes sticking out the window telling me I was going the wrong direction when I was trying to go back to the school bus, telling me I needed to go back to the Special Olympics, and that's where I belonged, and they were just really not accepting, because most people had knee surgeries, they're back on the field again, right? So people didn't know what was wrong with me, and nothing wrong with me, but they didn't know what was, I don't want to say anything was wrong with me. I have lots of disorders, but it's not wrong. But they didn't know what was happening to me and why I wasn't bouncing back like they were. So instead of believing me, I was faking it. So not only did I get it from doctors, I got it from peers, and I was excluded by quite a lot. It was okay to have me run the meetings and be in charge of all the school organization activities. It was not okay to be friends with me. And so that was actually a theme that continued through college and law school as well. I mean, I remember in law school, I was the vice justice of the law fraternity, and being at a meeting in a pub, right? We were all had our executive board meeting. I had my power chair at the time. After we had our meeting, they all got drinks and went up 5 stairs to a different landings to go have their drinks afterwards, which was a very clear delineation of me not being accepted. Not that I couldn't have gotten out of my chair, but the fact that they made that movement made it very clear I was not accepted as part of that activity. I remember being referred to as an it or that in law school by another student, asking the teacher to be moved from it or that. And I'm going, I'm a human, right? And the teacher apologized via email to me. And I go, well, I appreciate the apology, but it would have been better to use that as a teachable moment, because we're not actually talking about kids here. We're talking about professionals that are in law school. We're not talking about college kids, right? Most of us are postgraduate already, had a postgraduate degree before the law school. So we're not talking about little children anymore. And even children who I work with, I talk all the time. I correct all the time. I mean, they may ask me what's wrong with me, and then I break the ice because parents are usually freaked when kids say what's wrong with you. I turn around and say I'm a decommissioned cyborg. And then,
Great answer. Yeah.
Break the ice. And then I explain my braces are my exoskeleton. And then I explain what my service dog does for me. And the parents kind of freak. I have no problem explaining to kids, because kids need to know and understand invisible and visible disabilities, especially since not only do I have many and cognitive challenges, I work a lot with kids that are neuroatypical. So I very much, in my heart, always want to encourage and help people understand there are so many things we can't see that impact us, and how to still work with or try to socialize or incorporate and not exclude. And that unintentional exclusion, how much harm that does to someone's self-esteem and self-image of themselves. It's taking me a long time to consider myself pretty or beautiful or even comfortable in my own skin. I mean, yes, I have tons of braces, and that's not exactly comfortable in the first place. But, and I have to have my hair short because I can't curl it anymore. I can't do it long because it literally is too hard. I actually already have a stand for my blow dryer, and just trying to hold a brush to curl it to let blow dry it takes all my energy type of a thing. So I have to keep it short, even though I prefer it longer. But that's the way it is. And to learn to accept that, or my slurred speech when I get tired, or it's common for people who know me well, know that I will at some point in time pass out. I've had that happen at a couple of my clubhouses. I joke around, people who know me on Facebook. I joke around, your friends understand your dysautonomia when you pass out on a Zoom meeting and everyone's still there when you wake up. Everyone doesn't being called to your house. I mean, so it's it's a unique experience, and each level I've had to redefine and learn self-acceptance. And that's what we were talking a little bit before about life changes, because one point I was on crutches, then I was on a scooter, which I ended up getting an electric scooter 3 days before college. I did not accept it. I made my dad drive it from the car to the dorm room. And he's kind of like, you really need to use this tomorrow to actually get to the cafeteria. You understand this, right? And I was, yep, I understand it, but I still refused it. And I couldn't mentally make that adjustment because it was right at college that I was given that label of disabled. So I had always planned on being a civil rights lawyer, working for the BIPOC community and the people that have low income, taken advantage of by social economic status type of a thing. Even in college, I worked the legal aid society, civil rights offices, and things like that. That was always my area of desire. Never wanted to be a disability represent just people with disabilities. That was never my end goal, and any never even came into my mind. In fact, I very much wanted not to represent that. And when I was given that label, disabled, I utterly was in tears. It was college orientation, and it was Passover, and my brother went to Albany as well, so we were visiting him. And I was in tears. And my dad, got upset, which was the first time I saw him upset outside of, a funeral. And my brother's like, "Quiet, you get a double room to yourself." I mean, he's like trying to tell me to
Look on the bright side here.
He's like, "You get a double room, man." And I'm like, "I don't care. I don't want to be disabled." But they're like, but he's like, "But you are." And I'm like, "No, I'm not." And then my first actual advocacy for disability rights ended up being my first day on college campus, because the president of the university came up to me and asked me to give him a 10-point plan of what I wanted changed on campus. And he said if they were within reason, he would do all 10 of them. And I'm looking at myself going, I know nothing about people with disabilities or what we need. But I created that plan, and I literally had a challenge. This is where I learned that people didn't speak up about who had disabilities. And this is where I learned I might have to be a voice for people with disabilities, because I asked people what they needed and nobody would tell me. Nobody wanted to speak out. So I literally went around campus putting myself in the mindset of somebody who was blind or visually impaired, hearing impaired, cognitively impaired. What would they need, and what do I need to give for that list? And he ended up putting everything I put on my list. He did, which was amazing for me. At first it was a really big challenge, this concept of being a disabled representative for people, right? Because that's not where I wanted to be. And over time, it very gradually changed from being just civil rights to, being disability rights, because I had to fight for life-saving treatments. And I realized if I'm having to fight for life-saving treatments, and I do have the gift of gab, and I do have the ability to argue. I mean, I've been arguing since I was a very young age, which is why everyone told me to be a lawyer. And having that ability, and I still had to fight and appeal. And at one point, I was appealing to the state level to get my oxygen concentrator. I mean, it was not an easy battle for that matter. And so I realized that people need somebody to speak out for them and teach them how to speak out. And my children just came home. And to speak out and represent, and not just represent, but educate and empower, because we lose so much dignity. For example, I've been mostly bedridden this past year. There's a lot of dignity lost in that. There's a lot of dignity lost in my 15-year-old and 11-year-old bringing me food. I mean, and bring me my fluids and things like that. And my 15-year-old brought me lunch yesterday, and he goes, "You haven't eaten all day, so here's why I brought your food." And he goes, "You could have asked," because I couldn't get downstairs. And I'm like, but I don't want to ask my kids to be my caregivers, right? So there's always that level of dignity lost. I mean, I don't have bladder control right now. I don't have hand control of my hand. There's so many, I don't have GI system control. I mean, there's so much I don't have control over. So I refocused to what I can control, which is my mental health, my mindfulness, my mindset. Can't control my pain, but I can control how I react to my pain, and I can control how I let my pain react. Controls how I react to other people. Right now, there is a pressure change. So I'm wearing my neck brace. My neck is at probably 9 right now. And I was, yesterday, my teenager was doing normal teenager stuff that I started to not have the most mindfulness response to. And then I stopped and I corrected it, because I'm also trying to, not to say it, but practice what I teach. So stopped, corrected myself, apologized to my son, and we reset and we restarted that conversation. But learning to be aware of these things has been a journey and a process, because as we continually change, and society doesn't consider this beautiful, this wheelchair that I have beautiful. I mean, I've been told when they can't see my braces, oh, you look so beautiful today. It's like, well, they're still there, or, you look beautiful in your chair. It's like, what? I wouldn't look beautiful. It wasn't in my chair, I mean, or strangers coming up like, I'm so proud of you. I'm going, because I'm out and about. And I've had that a lot, which if you know me and you're proud of me for my accomplishments, wonderful, great. I mean, I've been working hard with STEAM programs. I just helped facilitate something with universal program design with the children, with fourth and fifth graders. Great. If you're proud of that, or my breath work or my mindset, I'm wonderful. I appreciate that. But if you're proud of me for being out because I'm in a wheelchair, that's not really something to be proud of. It's a reminder that people with disabilities are still considered to be supposed to be home and not out and about, which is, again, one of the challenges we have with insurance is not covering what we need to be active in society, only what we need to get to and from our doctor's appointments.
Yeah. And there's
a whole other topic.
There's so much in there that you gave us, and there's so much. And what I want to kind of like draw our attention to and hit a button on was 3 points you made. One was that the self-acceptance was a journey, and I'd imagine it will continue to be a journey as different pieces of your body change in their abilities to do things. I loved what you said about once you were expected to be an advocate, that you stepped up to that, but that you also had to remember that yours was not the only disability. And I loved how you used curiosity and your imagination to kind of figure that out. And then also the reminder to the rest of us that the only reason that a lot of folks with disabilities aren't out in society is because society isn't prepared, it doesn't accommodate them. It's not because they themselves are limited. And so if we could shift systems and shift access, the world would be a completely different place.
One of the things I really want to focus on is reducing barriers, increasing access, whether it's through technology. And I was actually asked to not be part of a leadership program recently, just before COVID, because they were concerned about my ability to come to sessions. And I even asked, can we use Zoom for part of this activity? And they said no, which of course they ended up using Zoom towards the end of their program, which was infuriating. And it wasn't just for me, because if I'm being excluded, that means somebody who has anxiety or depression or or other cognitive challenges that may be repetitive are also being excluded. And I also always look for that silver lining in things. And although I've always, even in college, I worked at a disability center in a computer lab, and I was very much familiar with the different groups and visual and cognitive and brain injuries and so much. So my silver lining from Ehlers Danlos was meeting my husband, because I wouldn't have moved out west had it not been for the weather and the impact on my pain and my RSD. So that was my, silver lining there. And we have 2 wonderful children because of that. But for the myasthenia gravis, it was a lot harder to find that silver lining, especially because it really kicked me in the butt, took names and then some. It really impacted my other ones, and it impacted my children dramatically. But it's also given me much more empathetic to the invisible cognitive challenges, whether it's somebody with MS or cerebral palsy, not being able to get the words out, right? And there's so often I lose my word, or words, and I have that image in my brain, what I want to say. And it's not quite dementia, but it's definitely, I can't get that word out, and everyone's trying to guess for me, which just makes it like that much worse. And now I have much more empathy when someone is trying to speak that has cerebral palsy and having that difficulty of getting that word out, or paralyzed, or whatever, quadriplegic, or whatever it may be, or even somebody with learning disability or neuroatypical, and the challenges that they have. I'm much more empathetic to it. And I think it's also what draws the students to me more, because I'm more understanding from where they're coming from, and a little bit more understanding of how to break things down. But the one thing I would leave people with, right, is we all have something of value to give. And I mean, right now I'm in my bedroom, and so I have a whole nice little setup on my bed. My room looks like a photography studio and a craft studio. And my husband's fortunately very tolerant of this. I am very lucky. May not have won the lottery for rare diseases, but I did win the lottery in family. My husband and children are very supportive of me. Even my 15-year-old just the other day when I was saying, not apologizing, but saying that he's had a tough life having to watch me transition over this time. And when I was diagnosed with myasthenia gravis, it was right before his bar mitzvah. It was very traumatic for him. Well, but not that it wasn't for me too, but for him to see something like this happen to what they consider to be a bad, I'm not going to say that word, but a good mom. And it was really hard on them. He literally told me, and he's 15, my camera went out of focus. He told me he wouldn't have changed anything, that it's made him a stronger person, more thoughtful and more thinking into his future and experiences that he's had with me because of my scouting. And yes, I do work with tools. So I am an atypical mom in certain ways. And yet he said that he wouldn't change anything from all of the experiences. And so that was a very, very amazing moment as a mom, proud mama moment.
Of course. And I think that is a beautiful note to end on. So Deborah, thank you so much for your time. You are incredibly generous. And this was incredibly both educational and just lovely to have this picture of someone else's life. So thank you. If you agree with me and you love this video, please give it a thumbs up on YouTube. The YouTube algorithm is obsessed with those thumbs ups, and so it would be really nice. If you love conversations where you get to learn things about other people or about the world around you, then you'll love the rest of our channel, and please make sure to subscribe. How to get a hold of Deborah is underneath in the show notes here, and there's lots of ways to do it. Definitely come find both of us on Clubhouse. And in the meantime, we would encourage you to remember that the world isn't as accessible as it can be. And there are ways that we can make changes to do that. And I'll see you all next time on Welcome to My World. Bye.